Good afternoon, and welcome all University of Iowa retirees. And I'm Rick Walton. I'm on the program committee, and I'm standing in for Nancy Hauserman, who is our program committee chair, and she is in Cuba. And I'm sure she's enjoying herself. So, pardon? Oh, wasn't I speaking in the microphone? Oh, okay. Microphone doesn't. All right. I will do that. Again, I am Rick Walton. I'm on the program committee, and I'm standing in for Nancy Hauserman, who is our program committee chair. And it is indeed my pleasure to introduce Deborah Hughes, who is the director of benefits. And Deborah has been with the university for 9 years as the benefits manager and assistant benefits director. Richard Saunders retired recently in June of 2015, and she was then promoted to director of benefits. First, Deborah is a native Iowan. She was born and raised in Fort Madison. And prior to her joining the University of Iowa team, her employment included 13 years at HNI. What is HNI? Oh, Hans in Muscatine. Okay. She is a graduate of the University of Iowa with a Bachelor of Arts in Psychology and received her MBA from St. Ambrose. She holds several certifications, including a Certified Employee Benefits Specialist and a Senior Professional in Human Resources. And notably, and most important in this day and time, she's an avid Hawkeye and a Little Hawk fan who won their game last night. Deborah has 6 wonderful grandchildren, all of whom live in Iowa City. Well, Deborah has to be one of the busiest people on campus, so it is a particular pleasure to welcome her here today. Deborah?
Thank you so much. When they contacted me to say, should we even have a presentation this year, because not much has changed, we did decide that it would be a good idea to talk about the plan, even those things that are staying the same and those things that might be changing. I do thank you for your time, and I will be following my presentation with a representative from the Health Alliance plans. Then we will have time for question and answers. We have 2 microphones to take you to your, so that you can ask your questions. If you have personal questions, then both Jessica Wade and myself from the benefits office will be available, as will the members of the Health Alliance team. But I want to talk about what's not changing first. And what is not changing this year is that our dental plan was new and enhanced last year, but there are no changes to the dental plan or the premiums this year. The UI Choice plan is still going to be available for 2016. That is our Wellmark Blue Cross and Blue Shield plan. The university is also continuing their contribution towards that premium for those who retired at age 62 with 10 years of service. That contribution will continue into 2016. We're also offering the University Group Health Alliance plans, the 2 Medicare Advantage options that we rolled out at the end of last year, and those are continuing. You should have recently received a mailing from our office talking about the rates for this next year, talking about the availability of the UI Health Alliance. You may have received a packet from them in the mail if you live in one of the counties within their service area. So that's what's not changing. We're continuing to offer those, but I do want to talk a little bit about what is changing this year. For those of you who have the UI Choice plan, UI Choice is changing their pharmacy benefit manager. So if your UI Choice card will be replaced in January with the new card. So we're ending our open enrollment a little bit early this year. We have an end date for the retiree open enrollment of December 1st so that we can get our data to Wellmark earlier than we have in other years, so you can have your new card by January 1st. That doesn't mean that if you send something in on December 2nd that we wouldn't still take that enrollment, but it does mean if it's in by December 1st, then you'll have a very good chance of getting your new cards in time. Your ID number will not change. That will be the same. The only thing that will be changing is their pharmacy benefit number, the RX bin number, and the pharmacy helpline. So if you need to get a prescription filled on January 1st, you'll want that new number. They're changing to CVS Caremark, and everything that you see in your pharmacy plan will continue as if they hadn't changed that plan. By changing the pharmacy benefit manager at their corporation level, that does not mean we can only use CVS pharmacies. They just also happen to own some drugstores. But we can still use the same pharmacies that we've always used. Wellmark will still maintain and manage their drug list. And if you have any medications that you've been taking and you have a prior authorization on file for those medications, that will transfer over. So it should be very smooth, but you will want to look in the mail for your new card if you're staying on the UI Choice plan. Along that line, the other thing that we're going to be changing this year is for those who are on specialty self-injectable drugs. We have had those paying out of the medical plan in the past, and as of 1/1/16, those will be moved to be processed through the pharmacy, through the prescription drug benefit plan. Because self-injectable, you don't have to be in the doctor's office to have those injected. And we will see, Wellmark says, a 3% savings on those drugs by having it go through the pharmacy benefit. Now, the only difference you're going to see, because many people were going to the pharmacy thinking it should be paid that way anyway, now it will be automatically processed at the pharmacy. You will owe coinsurance, which is different than what you were doing before. You might have paid 10% coinsurance under the medical plan if you hadn't met your out-of-pocket limit, but you will see the lower out-of-pocket maximum of $1,100 for the UI Choice prescription drug benefit apply. So just a slight change that won't impact others, but for those who are taking the self-injectable pharmacy drugs, those will be processed through the pharmacy and should save our plan about 3% on those drugs. That is what most plans do. That's a more typical way to process those prescription drugs. The other thing that will be changing this year is that we have had some cost increases in our premiums for this next year, and that is something that for those in the Medicare carve-out plan, we have had in previous years. We did have a few years where there was no change. We did see a 3.7% increase last year for the Medicare UI Choice carve-out plan. That will be going up 9% this year because we saw an increase in the claims. Those premiums are based on the claims of the people in those groups. So with that change, we will see an increase in premiums on 1/1/16. If there's nothing that you want to change, those premiums will automatically update on 1/1/16. For those who are in the pre-Medicare UI Choice rate, we have not seen an increase in those rates for a few years, but that will be going up this year as well. So for those who are in the UI Choice Medicare rates, and there, if you have not received your mailing yet, we do have a list of rates on the tables outside, is that rate for the Medicare carve-out plan has gone up to $576 per month beginning January 1, 2016. If you're eligible for the university contribution and you were paying $264 per month, that will now increase to $288. For those people who are not yet in the Medicare carve-out plan, that rate is going from $476 a month to $534, and those people who were receiving the contribution, that rate will go up to $242. So a slight change in increases for those premiums for this next year. One of the things that I get asked a lot, I like that Rick said I'm a busy person on campus, and certainly everybody in the benefits office is this time of year. And I'm asked, why our UI Choice Plan rates are as high as they are. And one of those reasons, the key reason, is that it is a very, very comprehensive plan. And I encourage you, as you're taking a look at your benefit elections for 2015, to see what is the best for your financial situation. That by paying those premiums, the UI Choice Plan has coverage for hearing aids, which a lot of plans don't have. It has free generics, which no deductibles except when you're hospitalized, and it has worldwide coverage. You can see any provider anywhere in the world. If you're finding someone who participates with the National Blue Card Network, then those fees actually apply to your level 1, level 2 out-of-pocket maximum. So it's really a comprehensive plan, but I'm not a commissioned insurance salesperson. So if you find an option that works better for you, then we certainly encourage that. We did find, though, some people did the analysis to say, okay, I'm going to save $200 a month in premiums by going with a different plan, but if they end up spending $300 a month more in out-of-pocket costs, they really haven't saved anything. So I do encourage you to take a look at your anticipated spend and find out what might work best for you. We certainly have people available in our community and across the country through the Senior Health Information Program. That is a federal program that's operated on a state level. They do have offices at the Senior Center and are very familiar with the other options out there for people when they become Medicare eligible. They're not as familiar with our plan, but they can certainly help you decide what other options might work well for you. The problem we've had is if you go with one of those other plans, a public plan, and you're leaving the University of Iowa plans, then you can't come back. And if you have a spouse and you're leaving that plan, you're making that decision for your spouse. So I was very pleased last year when we rolled out this UI Health Alliance option, the 2 Medicare Advantage options, because that gave people a chance to see if that would work for them. If they don't like it, they can come back to UI Choice this year. And someone said, well, is everybody leaving UI Choice? And we are certainly not seeing that. We've seen some people try out the new plans. We've seen some people leave UI Choice for a plan outside of the university, and they can't come back. But there are some people who've tried these Health Alliance plans, and I have had no negative feedback. I did have a call from a retiree, and she was concerned because she went to get surgery, and her doctor recommended it, and the plan would not pay for it. And so she's ready to come back and to UI Choice, and the only thing I encouraged her to do is to call Wellmark customer service, and you have to call and ask for a higher level of customer service to let them know you're trying to make an open enrollment change so that they can talk about the what ifs in the plan, not about your current plan, because she was not a covered member with UI Choice this past year, to make sure that they would not have had that same reaction to that surgery. And I gave her the example of my husband. He was sure he wanted to have knee replacement surgery because all of his friends had. And Wellmark said, no, they get a new car, you can get a new car. But no, you're not ready to get your knee replaced until you've done these steps. And that was the best decision he's never made, and because Wellmark made it for him. He was able to get his situation resolved through medication, through physical therapy, and he didn't need his new knee. So I just encourage you to make sure that if you're not happy with this plan, that the plan you're going to will provide a better coverage. So just, we've had not a lot of people in the plan yet, but certainly we've had nothing negative coming back. One of the other advantages I think we have with offering this new plan is that it does allow spouses to make independent decisions. If you remember back when we had all the other plans, the CHIP 1, the CHIP 2, the CHIP 3, the spouses had to stay together. In this case, the retiree has to stay with one of the university plans in order for the retiree spouse to get to be in the plan. But they can make independent decisions about UI choice. One of them can be in UI choice, and the other one can be in the Health Alliance Medicare Advantage plan. They can switch the next year at open enrollment. It doesn't make a difference. However, if as long as they're within the university group Medicare Health Alliance plans, and that's the key point. We did have a recent confusion because Health Alliance is also publicly offered, and if you go with the public plan and not the University of Iowa plan, then you're going outside the university's plans and you're giving up the right to come back to UI choice at a later date. They've made some changes this year that I think make that much easier to understand, but I know they recently had a public meeting at the Senior Center and described their public options, which are slightly different than the UI Health Alliance. Our alliance is designed to incent people to use the University of Iowa healthcare system and their alliance partners. So, for example, there's no coverage under the HMO for Mercy Iowa City. The Health Alliance partner of Mercy Cedar Rapids is included if you're in the UI Group Health Alliance Medicare Advantage plan. If you're in the public Health Alliance PPO plan, the Mercy Hospital is in Iowa City is in network. If you're in the University of Iowa plan, the Health Alliance plan, they're out of network in the PPO. There's coverage, but it's out of network in the PPO. So keep in mind that the UI choices you're comparing is a Wellmark Blue Cross and Blue Shield plan. The UI Health Alliance plans are not. There are differences in how those plans work. If you keep your UI choice coverage, you'll receive your Medicare carve-out booklet, and you would go to your providers showing them your Medicare card and your UI choice card. That's not how it works under the Health Alliance plans, and they'll be talking more about those in just a moment here. So the one thing I wanted to mention too is that we are here to help you in the benefits office, and there's only so much we can do, however. Jessica Wade, Mary Eggenberg, Sanatina Fernandez are here to help you, but we can't make the decision for you as to whether you should stay with UI choice, switch to a Health Alliance plan, or take another option altogether. We'll be happy to provide you with any information you may have and answer any questions that we can, but the decision is really yours, and it's wonderful that we have the choice to make some choices. So at this point, I would like to turn the program over to Erica, who will be talking about the UI Health Alliance plans.
Good afternoon. Can you all hear me okay? My name is Erica Williams, and I'm with Health Alliance, and we are an option for the University of Iowa retirees. So we have two we have two Medicare Advantage plans. We came and spoke about those plans last year, and I would like to talk to you a little bit more about those plans this year and see if you have any questions that we can clarify for you about the plans, talk about some of the changes that are happening to the plans this year. And as Deborah mentioned, really educate you and see, talk to you about the options that we have and whether they might be right for you. Again, we're going to be available afterwards for questions. So when we get into the question and answer period, if you have a specific question about a procedure or something specific to you, would be more than happy to answer that for you. I am just going to kind of give a high-level overview of the changes and how the plan works. We could probably talk about things all day long, but I know you probably have other things you want to do today, so I'll probably keep my presentation to about 20 minutes and then see what questions we can answer for you after that. I do have a presentation running up here. I'm not sure if you can see it. I wanted to put that up there, but I'll also be talking, through all the information. There are a couple of points that I'll refer to that'll be on the presentation to try to demonstrate some of the benefits that we have. So a little bit about Health Alliance. We are an insurance company that is from the Midwest. Our corporate offices are in Champaign-Urbana, Illinois, so drove in here last night and stayed in the area for a little while. And we've been doing Medicare plans since 1997, and that's really when the Medicare Advantage plans came to fruition. It was something that Medicare started that year. So we launched our Medicare Advantage plans at the same time that they were available to the public, and we've been working with those plans ever since. So we have quite a bit of experience with our Medicare Advantage plans. We do have a large provider network. Deborah talked a little bit about the differences in the network, and I'm going to talk a little bit more about that. But we are closely aligned with the University of Iowa healthcare facilities and clinics and physicians. They are part of our network. And at Health Alliance, we do believe that we have very good customer service. We have a strong commitment to customer service and making sure that if you have a question, we get the answer for you. Most certainly can't say that we're perfect all the time, but we do really pride ourselves on quality and providing you with the information that you need. So hopefully we'll be able to answer your questions today. So Medicare Advantage plan is a little bit of a different type of Medicare coverage. It's one of the options when you become Medicare eligible that you can choose from. So you have the UI Choice plan, which is a self-funded plan, and then you have the choices with Health Alliance. You have an HMO and a PPO Medicare Advantage plan choice. And Medicare Advantage is called Part C in the Medicare world. It combines all the different parts of Medicare, so it combines Part A, which is hospital coverage, Part B, which is outpatient or physician coverage, and then it also combines Part D, which is prescription drug coverage. So if you're if you're going to move or you are on one of the University of Iowa Health Alliance plans, you get prescription coverage with that plan. As Deborah mentioned, you have options available to you in the public space, and those options don't always have pharmacy. So that's also one thing that you want to consider if you're considering leaving one of the university-sponsored plans. Medicare Advantage plans can also include extras like some vision coverage, some dental coverage, fitness benefits, nurse line assistance, those types of things. And you don't get that type of coverage with just original Medicare or with some of the other Medicare options that are available to you in the public space. So to be eligible for one of the Medicare Advantage plans, you do have to be eligible for Medicare. You must have a Medicare Parts A and B, and you must live in the plan's service area. So this plan is available to the retirees that live in our service area here in Iowa. And you must continue to pay your Part B premium too. So the Part B premium, you have to pay whether you are on the UI Choice plan or on the Health Alliance plan. So you would continue to pay that premium, in addition to paying a premium to Health Alliance to have the University of Iowa, one of our Medicare Advantage plans. So there are two options. There is a PPO option, and there's an HMO option. And the two options are pretty different. The PPO option has been fashioned after the UI Choice plan. So the coverage is going to be very similar to the UI Choice plan. There are a couple of differences because this is a different type of plan, but you're going to find a lot of similarities. The main difference between a PPO plan and an HMO plan is that with an HMO plan, you have to use providers that are in Health Alliance's network. If you go to a provider that's not in Health Alliance's network, you're not going to have coverage for your services. On the PPO plan, you can use providers that are in our network, and you're going to get good coverage there. Or you can use providers that are outside of our network, but you might pay a little bit more for those services. So for the PPO plan, again, if you want to see a provider that is not part of our network, you are welcome to do that. You can go to any doctor that accepts Medicare, or physician, facility, any place that accepts Medicare, but you'll pay less if you stay in our network. You don't need a referral, so if you need to go to a specialist, you can go to the specialist. You don't need a referral. Now with the HMO plan, it really is more of a situation where you work with the primary care provider and they're going to help coordinate your care. So what that means for you is your primary care provider would say, I think you need to go see a cardiologist maybe for your heart issue, and they're going to help you find a cardiologist. They're going to give you that referral. They're going to help to direct that care for you and work with that cardiologist. That does not mean that you have to get a referral and send it into Health Alliance and have it approved. As long as that person is in our network and your doctors are working together, that is fine. They will work together and make sure that they're coordinating your care. One thing that we've created this year is a specific website at Health Alliance. If you are comfortable getting your information on the internet, we've created a specific website for the University of Iowa retirees, and there are very quick links or ways for you to get to the provider directory so you can figure out if your doctor or provider is in the network. So that is healthalliance.org/IA-retiree. If you have, I kind of read that quickly, and I know that's up there too, but any of the information that we sent you in the mail has that website listed on it too. All right, so talking a little bit more about the provider network. So we are partnered with the University of Iowa healthcare, physicians, facilities, and so they are part of our network. Mercy in Iowa City is not going to be part of our in-network providers. So if you like to see Mercy in Iowa City and you want to consider one of the Health Alliance plans, you would need to consider that PPO plan, and you could go there and use your out-of-network benefits. So you would pay a little bit more to go to Mercy, Iowa City, and their physicians. Okay, so now we'll kind of start to talk a little bit more about the benefits. And for those of you that might be on a Health Alliance plan today, I'll kind of try to point out where we've made some changes this year. If you are on one of our plans today, you should have received, or you will be receiving in the next couple of days, a packet of information that explains all the changes that are happening to your plan this year. Now, if you want to stay on that plan, you are more than welcome to. You don't need to do anything. If you want to change plans, you could move from the HMO to the PPO, or the PPO to the HMO, or you could even go back to the UI Choice plan if you would like. but the packet of information is going to describe to you the changes that are being made in the plan. Also, if you are on one of our plans, you will be getting a new ID card. We have a very similar situation where we are changing our pharmacy benefit manager just like the UI Choice plan is. Again, that shouldn't be any interruption of service to you, but you will get a new ID card, and you should put your old ID card away or shred it and start using the new ID card because it will have the new information on it. You will not get a new member number, but we will have new pharmacy information on that card. Okay, so we have the two plan options here. We have the HMO option and the PPO option. And the premiums are listed there. The HMO premium actually went down a couple dollars this year. So it's now at $35. So we're actually going to lower the premium a little bit on that plan. And I want to talk through that a little bit. So we talked a lot, and Deborah's talked a lot about plans with Health Alliance that are available to the general public. So if you're not a University of Iowa retiree, we do have other Health Alliance plans available. Our HMO plan is very similar to what you can buy if you go out in the public and purchase a plan on your own. And because those were so similar, we wanted to kind of make a distinction between the two. So the University of Iowa retiree HMO plan has a $35 premium, and that's different than the premium that you could if you purchased a public plan. The premium for the PPO plan is staying the same, and that's $279, and this is a monthly premium. There is no medical deductible in network on either of the plans. There is a yearly limit, and that yearly limit is the maximum that you would pay out of your pocket for medical services in a year. So that's just medical. That does not include your any prescription costs that you would have. So for the HMO plan, if you have to have a surgery and see your doctor, maybe have to have some physical therapy, you will not pay more than $3,000 for your care in a year. For the PPO plan, there is a $1,700 limit on the in-network side. If you are using in-network providers, as well as going to providers that are not in our network, there is a $2,000 yearly limit. So you do have some protection if you're going to a provider that is not in our network. Okay, so we're going to continue talking a little bit more about the benefits of the plan. If you have a packet, you can see this was a guide that we included in the packet, and I'm going to be kind of following along in the benefits of the packet, and those start on page 4 if you'd like to reference what I'm speaking about. Okay, so this is a breakdown of the benefits. The first section there is the annual out-of-pocket maximum and the deductible. Those two I just spoke about, so that's that yearly limit of $3,000 or $1,700 on the PPO plan. You'll never pay more than that for your medical services in a year. Moving on, we'll talk about primary care physician visits. So on the HMO plan, this year, it was a $20 copay to visit a primary care doctor, and we're actually lowering that to $10 for 2016. It's still $5 to see a primary care doctor on the PPO plan. The specialist, so if you go see a cardiologist or an orthopedic surgeon, if you need to speak with one of them or see one of them, you would pay $35 on the HMO plan for a specialist office visit and $5 on the PPO plan. Emergency room coverage, which is worldwide coverage. So if you like to travel and you're going to be going out of the country, you have worldwide coverage for emergency situations. So if you happen to fall and injure yourself while you're traveling in a different country, that would be covered under both of our plans, the HMO and the PPO plan, and you would pay that $75 copay. That isn't a little bit of an increase on the HMO plan. That was $65 in 2016. On the PPO plan, you would pay $50 and then 10%. Urgent care, so if something happens to you while you're on vacation, you get sick, you get the flu or pneumonia or something like that, and visit an urgent care clinic or a prompt care clinic, you would pay $40 on the HMO plan or $5 on the PPO plan. So you can see the premiums on the HMO plan are lower, so $35 for the HMO plan, but you do have to stay in network. There's no coverage out of network, and you'll pay a little bit more out of your pocket when you go to seek services. And that's what Deborah was talking about. This is the balance that you need to consider. Do you want to pay a lower premium each month and know you have to pay a little bit more when you go to the doctor? Or do you want to pay a higher premium and know that you'll pay a little bit less when you go to the doctor? So that's really kind of the balance that you need to consider with the two different plans. Okay. So we have inpatient hospital for the HMO plan is $220 for days 1 through 7, and then beyond that, you wouldn't be paying anything. It would, beyond the 8 days, it would be no copay for you. On the PPO plan, that would be 10% coinsurance. Outpatient surgery on the HMO plan would be $175 copay, and on the PPO plan, that would be 10% coinsurance. Ambulance, a trip in the ambulance would be $225 copay on the HMO and then 10% on the PPO. Lab services or radiology, if you had to have an x-ray or something like that, you would pay 20% coinsurance on the HMO plan or 10% on the PPO plan. Both of these plans include 100% coverage for preventive services, so if you need to go and have an annual physical, have your cholesterol checked, those types of things each year, as long as it's considered a preventive service, there would be no charge to you. So we've talked through kind of a really high overview of the two different plans and how the medical coverage works. So medical is separate from prescription drugs on the plan. So we're going to change and start to talk a little bit about the prescription drug coverage now. So the out-of-pocket maximum or that yearly limit of $3,000 on the HMO or $1,700 on the PPO, that is for your medical services only. So when you start using your pharmacy benefit, you're going to have different copays and different costs. So the HMO plan, we have a special network on the HMO plan, so we have a special relationship with Walmart and Sam's Club. If you get a Tier 1, which is a generic drug, at Walmart or Sam's on the HMO plan, you're going to pay zero copay. So there's no cost to you if you get a Tier 1 prescription at Walmart or Sam's on the HMO plan. If you are on the PPO plan, you can go to any one of our in-network pharmacies and pay $0 copayment for your Tier 1 prescriptions, so that's your generic prescriptions. With the HMO plan, you're welcome to use any of our in-network pharmacies to receive your prescriptions, your Tier 1 generic prescriptions. So for example, if you went to Walgreens, you would pay $9. So you just get that benefit at Walmart and Sam's for your Tier 1 coverage. For the PPO plan, you would not have a copay for any Tier 1 or Tier 2 medications. Now, the PPO plan does not have a pharmacy deductible, so you're just going to pay your $0 copay or your coinsurance depending on where your prescription falls in the different tiers. For the HMO plan, there is a deductible on drugs that fall into tiers 2 through 5, and that deductible is $360. So that's an increase over the deductible this year. So tiers 2 through 5, once you meet your deductible, you would pay either $20 for Tier 2, $47 for Tier 3, $100 for Tier 4, or 25% for Tier 5. And on the PPO plan, again, there's no deductible, so you don't have to worry about a deductible, and you would pay either 30% or 50% coinsurance. Now, the HMO plan works like a regular Medicare Advantage plan that you can buy if you were buying one in the public marketplace. And it does have a coverage gap. So once you and the plan, so Health Alliance and you, your prescription costs reach $3,310, you enter a coverage gap. And you have a different percentage that you pay while you're in the coverage gap. This is the main difference between the two plans. For the PPO plan, you don't have to worry about a coverage gap. The protection that you get on the PPO plan is it has its own out-of-pocket maximum. So once you pay $1,100 out of your pocket for your prescription drugs, you aren't going to pay anything else in that year. So it's different between the two plans. So the chart here kind of shows the initial coverage period on the HMO. So again, this just applies to the HMO, where you're going to pay your deductible and your copayment amounts until the cost that you have, as well as Health Alliance, reaches $3,310. Then you'll move into that second area, which is called the coverage gap. And during that coverage gap, you're going to pay 58% for generic drugs or 45% for brand name drugs until your total drug costs reach $4,850. And then you're in the catastrophic period and your coverage changes again. So you would be paying something different. You would either pay $2.95 for tier 1 and tier 2, $7.40 for all other drugs, or 5% coinsurance, which is greater. Now, to me, I was telling Deborah earlier, this is just a huge math problem, and it's kind of complicated. But one thing is most people don't get into that coverage gap. If you have tier 1 prescriptions and you're willing to go to Walmart or Sam's or you go to another pharmacy, you're paying $9, most people don't enter that coverage gap. But it is something to consider that's there on the HMO. And if you're concerned about that, you can always call Health Alliance and we can walk you through the prescriptions that you're on and help you figure out your costs. Again, the PPO plan, those different coverage periods do not apply. And once you pay $1,100 out of your pocket for your prescription drugs, you're done paying for the year with your prescriptions. So it has a really great protection built into it. So we do have the pharmacy extras, which is some really good benefits on the HMO plan. If you take a tier 1 generic and you want to get your prescriptions at Walmart or Sam's, that's no cost to you. The other thing you can do is you can get a 3-month supply of any of the tiers at Walmart or Sam's, and you just pay 2 copays. So normally if you go to any other pharmacy that's in our network, you would pay 3 copays. If you go to Walmart or Sam's, you're just going to pay the 2 copays. The PPO plan has a really great benefit too. Any tier 1 generic at any of our in-network pharmacies is going to be no copay to you. And then a 90-day supply at any in-network pharmacy is just going to be 2 copays. So there's good benefits on either one, so good cost savings with your prescriptions on either one of the plans. The formulary is the list of drugs that we cover, and it's going to tell you what tier your drugs are covered under. So we included the formulary book in your packet, and it looks a little something like this. And so if you want to look up your prescriptions and try to figure out how much you would pay, this would be the book that you would go to. You would look for your prescription. It's going to have the drug tier next to it, and then you could figure out how much you would pay. Again, if you have a lot of prescriptions and you want to consider one of our plans, it's really great if you call Health Alliance and let us walk through that with you and help you figure out your expenses that you could potentially have in a year. So the tier, that determines how much you're going to pay for the drug. And then also some of our drugs require either prior authorization or step therapy, and that means that you might have to try another prescription first before we would cover one of your prescription, or we would cover that prescription. So there's a couple of things. If you're going to look to moving to one of the Health Alliance plans, you haven't been on it, you want to make sure you understand how your coverage would work on the pharmacy side if you have drugs. So you want to make sure that we cover your drug, and you want to make sure you understand what tier or how much you would pay for it, and you want to make sure that we don't have any requirements like step therapy where your doctor might have to show that you had tried another drug before you could receive that under the Health Alliance plan. So the plan does come with some extras, and I talked about that before. That's one of the things that a Medicare Advantage plan can offer. So we have a supplemental benefit this year that we're introducing, and that's $100 for you to use on vision, dental, or hearing services. So on the HMO plan, we do not cover a routine eye exam, but if it's your year to have a routine eye exam, you could use this $100 towards that coverage. If it's not your year to have a routine eye exam, you could use this $100 towards a new pair of glasses, new pair of contacts, or a hearing exam, or a dental cleaning, or maybe you need to have some dental work, you could use that $100 towards that. Basically, you go and you have your service. If your dentist or your vision provider bills Health Alliance, then we would process that claim and reimburse you up to $100. If they're not willing to bill Health Alliance, then you would just ask them for your bill, and you would turn that into Health Alliance, and we would reimburse you. That benefit is on both the HMO plan and the PPO plan. The PPO plan does have a routine eye exam is covered at a $5 copayment, but you could still use that $100 benefit for, glasses or a dental cleaning or hearing exam, those types of things. So another thing is if you choose the dental coverage through the university, and maybe you have you have a filling done and you have some costs associated with that filling, you could turn that in and use that $100 benefit. So we've really designed that to give you a little bit of extra coverage for some of those types of services to help you with those. So we have a Silver Sneakers fitness program, and this is where you have free gym memberships to several of the local gyms in the area. You can participate in classes, and they also have some at-home programs. So if you don't feel comfortable going to a gym, or it's wintertime and you don't want to leave the house, they have some programs that you can call and order and do right in your home. And then we also have Assist America, and this is a travel assistance program. And this is not a replacement for medical insurance. It doesn't pay your costs if you're away from your home or outside of the country and something happens to you. But it is a travel assistance program that can help you find your luggage or help you locate a pharmacy if you get into a different state or maybe a different country and have an emergency situation where you need to pick up a prescription. It can also help you if something very bad happens to you while you're on vacation and you need to have a family member flown to be with you until you can start to recover on your own. It can provide some services like that. So it's a really great benefit. It really has a lot of different things that it can provide you if you are a person that likes to travel. So I want to talk a little bit about some protections that you get with our plan. So if you have something that happens and you don't like the decision that Health Alliance has made, you have the ability to appeal that decision. And that means that you can call us and say, I think that my service should have been covered. I don't agree with your decision. And we would have to have an external company review that decision and make a determination, which means that it's not Health Alliance, it's not the university, it's a third party that's unrelated to all of us that would take a look at your situation and could potentially tell us that they disagree and we would need to change our plan of action. You also have the ability to file a grievance. So if there's anything that happens with your plan, you find one of the materials that you get might be confusing, or you don't think that we properly told you or advised you on the providers that are in the network, you can call us and file a grievance. And we will have to research and respond to that too. So there are some protections there for you with a Medicare Advantage plan, and that's something that Medicare wants to make sure that you have in place for you if you have any problems with your plan. So enrollment and billing options. If this plan, or either the HMO or the PPO plan, seems right for you, You will fill out your enrollment and turn that into Health Alliance. That's coordinated with Health Alliance. That's not coordinated through the university. What I do is give Deborah and Jessica a list of people that are on the plan each month so they do know who chooses the plan. But you would enroll with us. And we have a couple of different ways that you can do that. You could fill out the application, which was included in the packets that we sent you, and you can mail that back to us or fax that back to us. Or you can call and actually enroll over the phone. So if that was convenient for you, you could use the telephonic enrollment option and call. We'll talk you through the process. It's going to take about 20 minutes. You need to have your Medicare card with you. Make sure you have any important information, your social security number, your address, all that handy, and we can do that right over the phone. The billing will come from Health Alliance, and you will pay Health Alliance. This is not something that you pay to the university. So your premiums would come, your bill would come from Health Alliance, and then you would submit your premiums back to Health Alliance each month. We offer many different ways to pay your premium. So you can pay that online. You can do an automatic withdrawal from your checking or your savings account. You can get a monthly statement from us and send us a check if you would like to do that, or you can call and make a payment over the phone. So we're very open. Any type of payment that you would like to set up with us, we're open to that too. This is the contact information here for Health Alliance. So our phone number is 877-917-8550. We're there 8 to 8, October 1st through February 14th. So if you have any questions, you can call us from 8 in the morning till 8 at night, all the way through February 14th, and talk to us about your options. Talk to us if you want to go through your prescription, see how that would work. We're there for you. We also have that website that we've set up for you too, which will have all the information that we've sent you placed on the website. So I hope that you found this information helpful. I know I took a little bit more time, but I know the concept of a Medicare Advantage plan is still something that's pretty new to you since it just started last year. So I wanted to make sure that we talk through that again. So at this point in time, I think we'll go ahead and turn it over for questions.
Thank you, Erica. One thing I wanted to mention before we start the questions is that Erica made a very good point, is that the Medicare Advantage plans require that your physicians participate with Medicare. If you're seeing someone at UIHC, then you know they're going to be participating with Medicare. But that's not always true of all providers. I've had retirees who leave the area find out that they're in a new state, need to find new doctors, and are finding a hard time of finding providers who accept Medicare and accept new patients. So that's just a little bit of a difference. Thank you for pointing that out, Erica.
So on our HMO plan, if you're considering leaving the area, you're only going to have emergency coverage. So if you're somebody who likes to travel, or you're considering moving to maybe Florida, where it would be nice and warm right now, you would not want to choose the HMO plan. That's not going to be probably the best plan for you. The PPO plan does have out-of-network options, so if you travel and you need to have regular blood checks or something like that done, you could see any provider in Florida or Arizona or California. It is advisable that you find a provider that accepts Medicare, because if the provider does not accept Medicare, they can bill you some additional charges on top of what would be covered under your out-of-network benefit.
Thank you.
And it is time for questions, and there are two persons with portable microphones, and please address your question over the microphone and wait your turn. And keep your questions direct and concise, and to the identify the individual you wish to ask the question.
I read here that with UI Choice, if you're part of the eligible group, the university will pay $288. Is that only true for UI Choice, or can that be applied to the Medicare Advantage plan?
Thank you for your question. That can only be applied to the UI Choice premium.
For UI Choice. My wife and I both have UI Choice. My wife got hearing aids this year, and we were told by the people who did the hearing aids that if you got a model of hearing aid that was over $2,000, you could not use the $2,000 benefit. That it was only if you got a hearing aid that cost less than $2,000. Is that correct?
I am not aware of that, but I will certainly research that, and if you want to give me your name after that, and we'll
Okay.
take a look at that.
Thank you.
Not aware of that at all. Thank you.
What would happen if your particular drug is not listed in your formulary?
That's a great question. If your drug is not listed in the formulary, one thing you could consider would be looking to see if there was a different drug that you could work with your doctor to move to that we do cover. The other potential would be for your doctor to submit for a medical exception that we could potentially cover that. But if your drug is not on our formulary and you know that you really need to be on that drug and you're not wanting to change drugs, then that would be something that you would need to really consider about moving to the plan because you would likely not have any coverage for the drug.
In other words, there wouldn't be a way of securing that same drug through Health Alliance.
That's right. So Medicare requires that we cover drugs in each class. So if your drug was not covered, we would cover a drug similar to it. So we would ask you to try to take that drug.
Yes, I understand. In the past, I had used another drug that was not, it was not proper, it was not
Sure.
effective.
Right.
And so the one I have now is, and I've had it for years, and so that would be crucial for me. Thank you very much.
Over here. Can you tell me that, I'm looking at the pharmacy benefits, and down on the retail 90 benefit, it says preferred network pharmacies, and over on PPO, it says in-network retail pharmacies. What's the difference between a preferred network pharmacy and an in-network pharmacy?
That's a great question. Right now, our preferred network pharmacies are only Walmart and Sam's. So that's on the HMO plan. In order to get a $0 Tier 1 generic, you would need to go to Walmart or Sam's. If you're on the PPO plan, it's just any of our in-network pharmacies. And our in-network pharmacies, we cover all the major chain pharmacies, so Walmart, CVS, Walgreens, Costco, all those types of places.
Okay, another real quick one. What is the difference between co-payment and co-insurance?
A co-payment is a flat dollar amount that you would pay for services. So if you see $5, that's a co-payment. You know every time you go and receive that service, you're just going to pay $5. Co-insurance is actually a percentage. So you might see 30%. That would be paying 30% of whatever your bill charge is.
Okay, thank you.
I belong to the Health Alliance HMO plan, but for 30 years I have been going to the same optometrist, and I get my eyeglasses from him, and he is not in network. Can I apply for that $100 despite that if I need new glasses?
Yes.
Yeah.
There is no network, so you can use that $100 at any ophthalmologist, vision care provider, dentist, hearing provider. Yes.
Okay. I have a question about the out-of-pocket on the HMO plan. If you're out of network and you have a car accident and you need surgery, do the costs associated with that event go toward the out-of-pocket?
Yes, they would, because it's an emergency situation. That's a covered benefit under the plan. So yes, anything you would be responsible for with an emergency situation, a car accident, any type of accident that you would have would go towards your out-of-pocket maximum.
Thank you.
Where is detailed information about your network available?
So there's one of two choices for getting the information about our network. You can visit our website, which is thehealthalliance.org, and then the / Iowa retirees. We have the network links right on that page for the HMO or the PPO plan, or you can call us too, and we can check your providers.
And we've recently added that to the university website under the benefits for retirees, links to their information, to have it all in one place. Thank you.
How long do you anticipate using UI Choice? I mean, in other words, you have it running for this year, is that correct?
I'm sorry?
UI Choice?
Yes.
How long will you continue to have that available?
We expect to have that to continue to available indefinitely. We don't know of any plans to change that at this point. We have evolved with different plan options over the years in that we used to have Chip 1, Chip 2, Chip 3, Iowa Select, Iowa Care, but they've all been combined, if you will, into a plan that meets many needs. So as far as I know, we'll continue that as is into the future.
Well, for future, I found it very confusing. I did not know that UI Choice was still going to be available this year. So I got all excited when I got this packet of information, and I've been in agony over it because I have a couple of situations that wouldn't have been covered. So I think in the future, it would have been nice if we could have gotten a cover letter included or something explaining that this is in addition to the UI Choice.
Instead of, yeah, it's a different option, yes.
Yes, that's my
Yes,
point.
yes,
I mean,
yes.
I wasn't here last year. I didn't know about when you added this on. And so this came out of the blue for me, and I was quite confused.
Yeah, and I apologize for your concern. We've also had people thinking they need to sign up for both, rather than understanding that there are different options and you can switch back every year at open enrollment. But the mailing came directly from them, and we sent our mailing out separately. But it will be coming soon, I hope. Thank you so much for those comments, though, and we're making this process better each year and commit to make it better for next year as well.
I have two questions. The first is for UI Care. I'm continuing that, and I need to get my prescription card by the first of the... Will you review what we need to do, if anything, to get that card?
If you're staying with the UI Choice plan, then that information will automatically be sent to Wellmark Blue Cross and Blue Shield the first week in December, so that they can get that processed and get that in your hands before January 1st, so that you have your new card.
Okay, so we need to do nothing.
You need to do
as long as
nothing.
we are enrolled. Okay.
Right.
And my second question is in the HMO, why is Mercy Iowa City not included?
That's more a question for the university, is that in developing this alliance with the group Health Alliance Plan, the thought was that we want to encourage people to use the UI Health Systems providers rather than other local providers. People within the Health Alliance share the EPIC system and have access to information. The Mercy Iowa City Hospital is not signed an agreement to share that information, so they have not included them in their Health Alliance partners. It's only limited to the University of Iowa Health Systems Health Alliance partners.
Yeah,
I'm sorry?
Many of our town physicians work out of Mercy Hospital.
Yes. Yes.
With UI Choice, does it still offer coverage for overseas health care?
Yes, the UI Choice coverage does offer worldwide coverage. And one of the reasons that the cost is a little bit higher is that you do have such a broader provider network. Typically, the more narrow the network, the lower the cost. But it does provide worldwide coverage. And we do encourage you to keep your costs down if you are traveling internationally, to use a worldwide Blue Card provider to make the ease of claim filing, but it would cover any provider.
Does that worldwide choice coverage include physician fees as well as hospital cost, everything that you might incur in an accident out of the country?
Yes, the UI Choice coverage should include those services outside the country. One of the things that is with the pharmacy benefit is that if you are traveling outside of the country, it's very difficult to get a refill of a prescription because they want you to get your prescription drugs in the U.S. If you're prescribed a new medicine when you are abroad, then that will go through the system very well. But they don't want people traveling just to get there.
And does that include evacuation insurance?
I'm not exactly sure, but I will certainly check that. Thank you.
Could I follow up on that, going back to a previous question? You said that U of I Choice would continue indefinitely. Would you include both employees and retirees in that statement? Will U of I Choice continue indefinitely for retirees?
As far as I know, we will continue to offer that. One of the things that we definitely do is do an analysis of our plans each and every year. We also expect the Health Alliance to continue to be a partner with us, but we do take a look at those every year. But if anything would change, if we would have new plans offered, we would certainly make those available and make sure that you know that.
Hi, does it just, I'm a big fan of UI Choice. And I brought with me not a problem. It's one I've been through, but it is to point out to either you or the people here who are covered by UI Choice. My husband was in nursing home, skilled nursing, Windmill Manor, to make it explicit. And when he was to go into hospice, they said we would have to assume the room cost for that hospice. And during the hospice time, he only was alive 5 more days. However, I checked with Blue Cross Blue Shield, and they said he was covered for the room charge, but it had to go through Medicare, get denied, and then sent to them. Since that time, I must have had 20 calls between the different entities. One, the nursing home wanted to have hospice Compassus from Cedar Rapids submit it. They do not do that. They submit only for their own services. Then I went back to Blue Cross, and they called the home, and then finally, we had a conference call. It still was not resolved. Finally, the last check that I had was with a new bookkeeper who seemed to understand. But they go through a corporate billing service that doesn't understand. Now they have it back. So all I'm saying is I was kind of fighting for all of us in this room who might be faced with that. I don't know whether all nursing homes in the Iowa City area are like that, but I kept saying there are a lot of people on UI Choice who might be here. So maybe you could give me some idea of what other measures could have been taken, or whether you could alert people to this.
One of the things I might recommend, and Julie will have to forgive me for bringing her into this, but we have Julie Sexton here who's with our UI Health Plans office. And one of the things her office does is help with claim resolution areas. Our office can also help expedite some of those issues that you run into, because we want to make sure things are processing correctly. With the gentleman with the hearing aid situation, it sounds like somebody was reading our benefit wrong and are interpreting it incorrectly, but we can certainly help to get those claims to move through the system and have them work. So thank you for making us aware of that.
Would you clarify, does Mercy, is that included in UI Choice?
Yes, with the UI Choice plan, that Mercy is part of level 2, not level 1, but level 2. So they are not considered out of network for level 3. They are considered in the Blue Choice network with the UI Choice plan.
Okay.
So they are reimbursed at level 2, and all the charges go to the level 1, level 2 combined out-of-pocket maximum of $1,700 a year.
Okay, thank you.
Thank you. The question was Mercy of Cedar Rapids or Mercy of Iowa City. Both of those hospitals are in the Wellmark Blue Choice Network, so both would be covered as level 2, as would all the hospitals in the state of Iowa.
Yes, I have a UI choice question. And specifically it is this, where it talks about the various tiers of service, tier 1, 2, and 3, the in-network and out-of-network. It always references a coinsurance amount, and there's a footnote that reads that the coinsurance is calculated based on Wellmark's maximum allowable fee. And I'm curious how that compares to the Medicare fee schedule.
That might be a Medicare Advantage question as well. Those are two different schedules and something to be taken into consideration in terms of the plan coverage.
So is the Wellmark fee schedule typically higher or lower than Medicare?
I think it's typically higher.
Okay.
Their allowed amount is typically more than Medicare, but I wouldn't say 100% of the time, but typically it is higher.
Okay, then that gives me a second question, if I may ask it. Under physician services, the typical Medicare benefit is a $147 deductible, and then it covers 80% of the Medicare allowable fee. So if one needed to go for a second opinion out of network for somebody who's extra high level specialist, with Medicare, you'd pay $147 plus the 20% of the Medicare allowable amount. If you use UI Choice, you'd be paying 40% of the higher Wellmark fee schedule. So it would seem to me you'd want to just say you had Medicare as opposed to Wellmark UI Choice in that situation.
In that situation, you would be subject to the 40% coinsurance, but if you're seeing a blue card, a national blue card provider, then those charges would go to your level 1, level 2 out-of-pocket maximum. But the two coverages work together with the UI Choice, and that's why they call it a carve-out. So certainly if there are things that Medicare would pay first, then the UI Choice coverage would work so that a lot of people, when they're combining those coverages, when the coverage is coordinated, they're having very little out-of-pocket payment required.
Right, I understand that. I'm just pointing out that if you use UI Choice under that scenario, it's going to cost you more money than just simply having Medicare Part B. Okay.
I have these first. I'll be back. Last year, we were told that if we went to Health Alliance, we would have a choice, we would have the option to go back. Does that continue as we continue on Health Alliance, or was that just a one-year thing?
No, that continues.
That continues.
That continues, yeah. So if you make a change this year, you can make the change to go back, to do it differently at the annual open enrollment period. It's only one time a year, but it's each year. You still have the option to come back at the annual open enrollment period, yes.
I have UI Choice and drug coverage through UI Choice. I recently received a note saying that, relatively minor thing, but Prevident prescription toothpaste with prescription level fluoride was no longer going to be recovered. I'm wondering what protection there is in general against getting a notice partway through the year saying, oh, we've decided to take whatever off the formulary. And what the appeals process is, and simply being told there are other fluoride toothpastes with no acknowledgement that they have much lower concentrations of fluoride, and there's a reason the dentist prescribed this, isn't satisfactory.
Wellmark Blue Cross and Blue Shield does take a look at their formulary and does make changes at least twice a year, sometimes more, as they see more cost-effective ways. That is their decision to make those changes. They do communicate with people who are using those and to providers as those changes come about. There is an appeal process through Wellmark, which is described in the benefit certificate.
I know the question wasn't directed at Health Alliance plans, but I did just want to kind of apply that same question to the Medicare Advantage plans. We only change the prescriptions that we cover at the annual enrollment time, so we can only change those once a year. If we're going to make a negative change, so no longer cover something or cover it at a different level, we do make positive changes, maybe covering something at a different tier or adding new prescriptions that we cover throughout the year. That's a protection that Medicare puts in place that we follow.
Considering UI Choice, I was pleasantly surprised to hear that you do cover out of the U.S. Medical bills. And I don't exactly know how that works with the suggestion that Medicare only works in the U.S. And does that mean if we travel outside the U.S., we really don't need to worry about getting sort of travel insurance just for the purpose of medical coverage?
That's a lot of questions in that one question. But yes, if Medicare does, because the UI Choice Medicare carve-out coordinates with Medicare, and if you're traveling internationally and Medicare isn't paying, then UI Choice will pick that up just as if you weren't Medicare eligible. And that is certainly why some people want to continue their UI Choice coverage if they're going to be spending a lot of time internationally. There is good coverage there, and if you're using a worldwide Blue Cross and Blue Shield provider, they'll help you file your claims, they'll help translate their charges. But I can't broadly say you would never need travel assistance because sometimes people want to get travel insurance that replaces their luggage, and that's not something that would be available through the UI Choice coverage.
I have a question I'm comparing the PPO and the HMO plans with regard to skilled nursing facilities. And I notice, first question, what happens after 100 days on the HMO coverage for skilled nursing? It says days 21 through 100, $125 copay per day. What happens after 100 days?
Sorry, I'm just trying to follow along on that and look
This
at.
is one of the things we got in the mail. And it would appear, at least from at the beginning, that the HMO has better coverage than the PPO. Yeah.
So starting off, for the PPO plan, you would be paying, that's a co-insurance, so you would be paying 10% of your cost of the skilled nursing facility, and you would be limited if you're in network to that $1,700. So there would be that cap, that $1,700 cap.
Even after 100 days? With the HMO?
Right, on the PPO. Now, on the HMO, that is a little bit different. So you have days 21 through 100, you would be at $125 copayment per day. And then days 100 and beyond, you have 100% coverage. I will tell you, most people never stay in there that long. And then you also have your $3,000 out-of-pocket maximum, so that's going to protect you on that too.
So for days 1 through 20, the HMO has no copayment, whereas days 1 through 20, the PPO actually has 10%, so it's more expensive.
That's correct.
If you're only, it's more expensive with the PPO for those 20 days.
That's
correct. Is that right?
Mm-hmm.
Okay, thank you.
Yes. The PPO is going to if you have had any other services, though, that $1,700, might also limit that too.
I think I know the answer to this. But I just wanted to check. I switched to the Health Alliance last year. One of the things I didn't calculate on was the cost of hearing aids. And I was 2.5 years along to the five-year thing. So do I get any credit for that 2.5 years when I get a new hearing aid?
We could not hear that. Could you repeat that, please?
Sorry. Okay. I switched last year from to the Health Alliance HMO. And when I was calculating costs, I kind of forgot about my hearing aid. And I was 2.5 years along to getting the credit for $2,000 for another hearing aid. So do I get any credit for that at all, since I'm no longer in the university system? I get my hearing aids through the university. But you know, you get $2,000 every 5 years. So I was only 2.5 years. Do I get any credit?
When you say credit, if you're staying with the Health Alliance plan.
Yes, I am.
Then there would not be coverage
No,
for that. If
there's-
you move back to the UI Choice,
But then I'd have to do the whole 5 years again, wouldn't I?
it's only a restriction, I think, of how often you've had that. So I think the fact that you had worked towards that and not used that benefit,
Uh-huh.
but I don't know that for certain. We can certainly check into that.
Okay.
Gina, Julie? Right, same policyholder, ID if she goes back. Right. Yes, 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 because she hasn't exceeded that within that 5-year period. That's my understanding as well.
Any other questions?
I think we'll wrap up the session.
I think we have
formally.
one more. I'm sorry.
One more
One
question? Oh, okay.
Yeah, one of the things we got in the mail was a reply card for sending away for more information. And there are 2 directories you can send for. One's HMO and one's PPO. From that, it would seem to imply that there are different providers for each of those.
That is correct. The major medical systems that are in the network are going to be the same. So the hospitals that are covered, both plans are going to cover the University of Iowa healthcare facilities and physicians. There might be some physicians outside of those medical affiliations that might be different between the 2 plans.
Like, do you have any idea how often the Towncrest physicians are included as providers?
Did you say the Towncrest?
Towncrest.
Yeah. I apologize. I would have to look that up for you, and we can do that if you'd like afterwards.
But there are,
Oh, they are. Okay. So they would not be covered then, right?
so there,
Yeah. So I apologize. I'm hearing that they are affiliated with Mercy Iowa City, so they would not be covered
Okay.
on the HMO, but you could see them out of network on the PPO.
and the PPO, but my question is, the HMO provider directory is smaller than the PPO directory, right? So you have to be even more careful about finding your physician if you go for the HMO.
That's correct. You would see some limitations on the HMO that would probably be covered in the PPO. But again, the University of Iowa healthcare facilities and their physicians would be covered.
Right.
It's those ones that would not be affiliated with them that you would need to check.
Okay, for those of you who remain, our 2 speakers will be here for a while after this session if you have any personal questions. Thank you for your attendance, and thank you to our speakers.